Welcome to today's Explainer. We're diving straight into a real operating room staple today, pyrolate injection, or as you probably know it, glycopyrrolate. If you're prepping for clinicals or just trying to lock down your pharmacology, getting a solid grip on this specific med is absolutely crucial for surgical patient care. So let's just get right into it. Now, right out of the gate, we've got to hit on a major medical warning from our source material. Before taking any medicine or injection, you must consult your doctor. Look, as nursing trainees, you already know this, right? But it really does bear repeating. Pyrolate is a highly specific prescription-only tool. It demands strict medical supervision and is absolutely not something you just administer casually. Respecting its power is literally step one.
Okay, let's dive into the structure. We've got 4 main sections to hit today: the anticholinergic mechanism, surgical and clinical uses, key side effects, and finally, formulation and specs. Moving right along.
Section 1. The anticholinergic mechanism. Understanding this drug's class is the absolute key to understanding literally everything else it does. So what exactly is an anticholinergic anyway? Well, in plain terms, it's a medication that completely stops the action of acetylcholine. Now, acetylcholine is a major neurotransmitter in our nervous system. You can kind of think of it as the body's super dedicated messenger boy, right? It's constantly sprinting back and forth, firing critical messages from your nerves straight to your brain. When we bring an anticholinergic drug like pyrolate into the mix, we're basically dropping a massive roadblock that stops that messenger right in its tracks. And this brilliantly illustrates the mechanism. Think about it like this. If an ant bites you, acetylcholine immediately fires off a pain message to the brain so you feel it. Ouch, right? But if pyrocarpazylate is already in the system, that neurotransmitter's transmission is totally intersected. Boom, blocked. The message never even makes it to the brain. The drug suppresses acetylcholine's ability to do its job, essentially silencing those specific nerve signals.
All right, Section 2, surgical and clinical uses. Let's see how this microscopic roadblock actually translates to real-world clinical benefits for our patients.
Which brings us to a huge question. Why is it so absolutely crucial to block these neurotransmitter signals during surgery in the first place? I mean, we're in a high-stakes environment where the patient is incredibly vulnerable. So why on earth would we actively suppress their normal nerve pathways?
Well, think about the body's normal state. We are constantly producing secretions and mucus, right? But under general anesthesia, all of that can pool up and actually obstruct the patient's breathing passages. That is bad news. Enter pyrolate. When we introduce it, it blocks the acetylcholine that's stimulating those secretions. The result? The respiratory channels stay completely clear and dry. It's a total game changer that ensures the airway is safe and unobstructed while the patient is on the operating table. In your day-to-day nursing workflow, you're going to see this used heavily in preoperative and intraoperative general anesthesia prep, specifically for clearing that respiratory tract. But get this, it's actually got a dual purpose. Those exact same drawing and blocking properties make it super useful for treating peptic ulcers too, because it stops the signals that tell the stomach to secrete harsh inflammatory acids. Pretty clever, right? Moving right along to Section 3, key side effects. Because you know a mechanism like this doesn't come without a catch. So the crucial point here is how this intentional disruption causes very specific side effects. Because of those intense drying and blocking capabilities, you have got to watch out for certain reactions. We're talking tachycardia, so rapid heart rate or anxiety. Dilated pupils are definitely a common one. And since we're drying up bodily secretions, you'll naturally see reduced sweating, which obviously messes with temperature regulation, along with urinary retention and blurred vision. As nurses, keeping an eagle eye out for these so you can report and manage them is just absolutely essential. Okay, let's wrap up the pharmacology and get into the practical stuff. Section 4, formulation and specs. Now, what's really interesting here is this very specific concentration, 0.2. When you grab a standard 1 milliliter ampule of this injection from the pharmacy, it contains exactly 0.2 milligrams of glycopyrrolate. This precise formulation is what allows anesthesiologists and doctors to calculate those minute doses. They need that perfect balance, drying out the airway without completely overwhelming the patient's system. And just for some supply chain context, the specific injection highlighted in our source material is manufactured by Neon Laboratories. They're a highly reputed company within the Indian pharmaceutical industry. Knowing exactly where these essential meds come from is just a really good practice for your inventory awareness. And here is a pretty wild, very practical number, 10. Despite being this highly specialized, absolutely critical component of major surgeries, this ampule is incredibly accessible. The source actually points out it costs roughly just 10 rupees in the market. It's a great reminder that sometimes the most life-saving essential interventions in a hospital aren't always the most expensive ones.
When we look at administration, this setting is almost entirely the operating theater, usually given right before or actively during surgery. Dosage-wise, you're generally looking at 1 to 2 times a day, but again, strictly as prescribed. And the biggest takeaway, circling all the way back to our very first point, strict doctor supervision. You just do not improvise with an anticholinergic. Ever.
I want to leave you with a final thought today. Since we know pyrolate creates intense drying side effects, how does the predictability of these reactions actually make it a safer, more reliable tool in the highly controlled environment of an operating room? It's a fascinating paradox, isn't it? The things we normally label as adverse effects are the exact things we demand to keep a patient safe under anesthesia. Keep exploring.